Hello, my name is Mike Williams. I'm a vascular surgeon at St. Louis University. And now I'm going to present to you how I do the exposure of the proximal cervical common carotid artery. So this procedure, most commonly these days, we're doing for the TCAR procedure. The way that I do it, I take the patient to the operating room, place them on the table in the supine position. Similar to a carotid endarterectomy, the goal is to get the neck extended and rotated to the contralateral side. So it helps me to put the patient into a very slight beach chair position, meaning I put the bed in a little bit of reverse Trendelenburg and then tip the head of the table down with the foot of the table slightly up and then rotate to the contralateral side. And I usually put a shoulder roll underneath the patient's shoulders to get maximal extension. And if the head is floating a little bit, one of those gel donuts to support the back of the head. This should facilitate opening up that space, getting a lot of room to work at the base of the neck. Landmarks here are important. So the proximal cervical common carotid artery can be accessed in the triangle that's created between the two heads of the sternocleidomastoid muscle, the sternal head and the clavicular head, and the base of the triangle being the clavicle. Usually I use an ultrasound before I start and mark out that triangle between the two heads with a skin marker, and then mark out where the common carotid is going to be right in the center of it with the ultrasound using a skin marker as well. And here's just a depiction of what it looks like. You can see the triangle that I'm talking about, the sternal head, the clavicular head of the SCM, and the clavicle being the base. And then right in the center of that triangle, you'll find the carotid sheath. You'll notice that the jugular is just a little bit lateral to the common carotid in this position. And that black dotted line there marks out where I'd make my incision. So for this, I usually do a vertical longitudinal incision about 3 or 4 centimeters in length, right in the middle, overlying the common carotid artery. You know, for a TCAR, you could do a transverse incision because you don't need to have a huge amount of the artery dissected out. But for any other indication, say for a trauma or something, this would be a vertical incision. Once you're through the skin with the scalpel, you can use the cautery to divide the platysma, and then you're going to be diving down towards the carotid sheath. You want to stay proximal to the omohyoid muscle as you get into the carotid sheath. You want to be lower down than that. As you open the carotid sheath longitudinally with Metzenbaum scissors, again, you'll notice that the internal jugular vein is often slightly on top of it or mostly lateral. And so you're going to want to retract that laterally with your Wheatlander retractor to expose the common carotid. You can then dissect out the common carotid sharply, staying right on the artery with your Metzenbaum scissors, and place a vessel loop or an umbilical tape with a Ramel tourniquet around it at the base. And that is how I dissect out the common carotid artery. Thank you.
All right, perfect. Thanks a lot. Appreciate it.
Sure, no problem. Thanks.
Yeah, and thanks for covering that case today. Our washing machine exploded earlier this week. My wife's been bugging me to like let her get to the store and stuff, and
yeah,
the piles of laundry have precluded it to this point.
That's no problem. That's no problem. Should be a pretty short, easy case.
Yeah, and you know, like I said, if they dick around and it's not, they can't get it going, I can do it next week. The guy is not the compliant person in the world, so.
All right. Well, have a nice weekend.
All right. Let me know if you need anything.
Thanks.
Bye-bye.